lying beside you, hearing.
I'm Dr. G. And I'm Dr. B. And we are the medical examiners.
This is what I brought.
Our case today starts 750 kilometers away from a Walmart distribution center.
By a young man we think the name of is William Penny. We found a wallet nearby, but you never know these days what might happen.
We're not sure if the young man was intoxicated or not, but we have high proof of it. We found him located right outside of the pool. We're not sure what happened or why it happened, but we're here,
and that's our job,
to figure it out. Here's what we think happened to William Perry.
What his friend thought would be a harmless prank turned into a deathly disaster.
Over here you can see chemicals that were probably used earlier to clean the pool.
A little too much chemicals in the pool most likely killed our friend.
We'll show you what happened next.
Hey man, how are you?
Good, how are you?
I'm doing pretty good.
I think I'm gonna go jump on the track now.
Hey man, I got you a drink.
Oh good, I was thirsty.
No. I think he's dead. I hate this.
Looks like the friend tried to hide William Perry over here, but didn't make it very far. We'll carry him back to our laboratory.
Spend all your time waiting for that second chance, for a break that would make it okay. If I die young, bury me in satin, lay me down on a bed of roses, sink me.
Okay, Dr. B, first up we're going to make a deep incision all the way down the front of his chest and nearly to the pelvis. So there we will begin with this.
Okay.
Ooh, looks like there's a lot of liquid left up in here. Good thing we caught the body when we did, or else we would have been in trouble.
So do you believe the body started breaking down? The tissues were dissolving?
That's probably my first guess. We named
So how long? Body's approximately sitting out for 12, 15 hours?
Yeah, that's roughly the time that I would say. I also think we need to get a sample of his blood to check out his toxic level.
Okay, can you give me a sample so I can test it? I'll get the syringe.
Yeah. If you could get me a bottle to put it in, please. Thank you. Great. Here we go, dissecting for the heart. So next, Dr. B can examine it.
Right
This
now,
is always a tough process.
examining his blood, and it seems like there's nothing wrong with it. A little bit of clotting, but nothing bad.
Looks like we got it.
You have the heart?
Yeah, here we go. Come here, Dr. B.
Hand me that part. Thank you.
Some people find this smell repulsive, but being a medical examiner, we just get
I'm
used to
cutting
it.
open the heart.
Does it look like they're in coronary heart disease or heart attack or anything of that sort?
All I can see are that his arteries were flowing pretty well. Same thing I would expect from a 15-year-old kid.
Good, good.
Nothing wrong. Veins are perfectly fine. The blood's a little discolored in this area.
We might need to test that out a little bit more.
I'm really starting to think it was definitely the poisoning.
That's kind of what I remember this case says. Did you check the intoxication level? What did that come back as?
The intoxication level came back as not anything, so I don't know whether to think it was a poison. It definitely wasn't drinking or drugs.
That's the way I was heading, so maybe we do need to check out the different types of poisons that could have been in his body. We could go in and test to see if there was a increased amount of these certain chemicals, which I
think we should test his brain next to make sure that there wasn't any clotting, just to make sure. Then after, the test is still coming back for the chemicals through the blood, so I'm not sure what that.
Okay, well let's go for the brain next, make sure there wasn't any clotting or any hemorrhages or anything of that sort.
Okay.
Just to be safe. Then once we get the chemical report back, we will hopefully know what goes on from there. With cases like these, you just don't always know, so you gotta try everything and just kind of...
Sometimes the smallest things can come back and bite you in the butt and just say, it was me.
Yeah, so let's go to the brain next.
Okay, I'm done with the heart. I pretty much tore this thing apart. Definitely isn't beating anymore.
Okay, here I go, operating the brain. Now that we got William Perry's whole bottom half of his body nearly dissected, I would quote say, we're going to move up to the brain area just to test and make sure that there wasn't any hemorrhages, any sort of thing like that could have caused death. We are trying to rule this as a poison case, but we don't know if it was homicide or suicide, so hopefully some information in the brain will help us out. I'm going to rub the substance on his head just before I get going on the brain, just loosens it up a little bit. This is a part I always seem to dread. It's just not one of my favorite things, slicing into someone's head, but sometimes you just gotta do it. Okay, got that cut. Now the worst part is prying the head open, so if you could hand me those things one time, please. Sorry, I can grab them.
Thank you, Dr. G.
Oh! 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 So you got that there. Now we just start pulling, and looks like up near his frontal lobe there's quite a bit of discoloration. I mean, I wonder if it could be from the chemicals or...
Definitely could be. We'll test that.
Yeah, let's just get a sample of the brain and you can just see what you think, Dr. B. I'll just hand this over to you. Oh, there's a bit of... quite a bit of abnormal bleeding, I would say, but shouldn't be the case here. What are you saying, Dr. B?
There's this, come in close. There's this speck right here. I'm not exactly, it definitely looks like it could have been a blood clot, but you never know. This kid surely doesn't look to be obese. I don't think it was from a lot of eating. I'm gonna break in. Okay.
Sometimes always the poison can travel up through your veins, up to the brain. So that might be some of the things we are seeing.
Oh, I know. There's abnormal bleeding. He must have fallen when he took the poison and hit the back of his brain. Oh, I know exactly. We're not exactly sure if he got poisoned, but I know one thing's for sure. We'll use this skeleton as an example. We like to call him Harry. Back here, we believe what happened on William Perry was he hit his head quite hard, causing internal brain bleeding, which is obviously
The bleeding we could just see in the brain.
So I'm pretty sure that's the reason why. And oh, looks like I just got the test back.
Dr. B, what did you find out?
There's definitely some poisoning. So
From my perspective, I would think the poisoning would be this, and
it came back as chlorine and the shocking fluid. So our theory definitely was right, and we proved it wrong. So now we must call the family and tell them what happened to their beloved William Perry.
That's all for Dr. G and Dr. B, and we'll see you in the next episode. And